Welcome. Have you ever heard of anterior capsular fibrosis? It's a condition that can affect vision after cataract surgery. In this video, we'll delve into what it is, what causes it, how it's diagnosed, treated, and what you can expect. So, what causes this fibrosis? The primary cause is the natural healing process of the eye following cataract surgery. During surgery, the cloudy lens is removed and replaced with an artificial lens, called an intraocular lens, or IOL. The IOL is placed within the lens capsule. Anterior capsular fibrosis arises from the proliferation and migration of residual lens epithelial cells that remain on the anterior capsule after cataract removal. These cells can then transform into myofibroblasts, which contract and deposit collagen, leading to thickening and opacification of the anterior capsule. Now let's talk about how this process unfolds inside the eye. After cataract surgery, the remaining lens epithelial cells undergo a process called epithelial to mesenchymal transition, or EMT. They transform into myofibroblasts. These myofibroblasts then start producing collagen, a fibrous protein that builds up and thickens the anterior capsule. The contraction of these myofibroblasts also causes the anterior capsule to wrinkle and lose its transparency. This clouding and distortion of the capsule interferes with the passage of light to the retina, leading to blurred or distorted vision. Anterior capsular fibrosis is a relatively common complication following cataract surgery. The incidence can vary depending on several factors, including the surgical technique used, the type of intraocular lens implanted, and individual patient factors such as age and underlying health conditions. Studies estimate that it can occur in a significant percentage of patients within a few years of cataract surgery. It's worth noting that advancements in surgical techniques and IOL designs are constantly being made to minimize the risk of developing this condition. What are the signs and symptoms to watch out for? The most common symptom is a gradual blurring or decline in vision, even after successful cataract surgery. Patients may also experience glare, halos around lights, or difficulties seeing in bright light. In some cases, the capsule contraction can even cause a slight distortion of the implanted lens, leading to refractive changes and further visual disturbances. These symptoms usually develop months or years after the initial cataract surgery. How is anterior capsular fibrosis diagnosed? The diagnosis is usually made during a routine eye exam. Your ophthalmologist will use a slit lamp, a specialized microscope, to examine the anterior capsule. They'll be looking for signs of thickening, opacification, and wrinkling. In some cases, additional tests such as optical coherence tomography, or OCT, may be used to assess the extent of the fibrosis and rule out other potential causes of vision loss. While anterior capsular fibrosis doesn't have distinct types in the same way some diseases do, its severity can vary. It can range from mild opacification that doesn't significantly affect vision to severe fibrosis that significantly impairs visual acuity. The progression rate can also differ from person to person. Fortunately, treatment for anterior capsular fibrosis is generally straightforward and effective. The primary treatment is a procedure called wide laser capsulotomy. During this procedure, a laser is used to create a small opening in the clouded posterior capsule, clearing the path for light to reach the retina. The procedure is quick, painless, and usually performed in the ophthalmologist's office. The improvement in vision is often immediate. In very rare cases, if wide laser capsulotomy is not feasible, surgical removal of the fibrotic capsule may be considered. Can anterior capsular fibrosis be prevented? While it's impossible to completely eliminate the risk, advancements in cataract surgery techniques and intraocular lens designs are aimed at minimizing the likelihood of its development. For example, some IOLs are designed with a sharp posterior edge, which helps to prevent the migration of lens epithelial cells. Meticulous surgical technique during cataract extraction is also crucial to minimize residual lens epithelial cells. Following your surgeon's post-operative instructions carefully is also important. The prognosis for patients with anterior capsular fibrosis is generally excellent. Wide laser capsulotomy is highly effective in restoring vision. It's important to remember that the procedure is not without risks, though they are generally low. These risks can include retinal detachment, glaucoma, and inflammation. Researchers are continually investigating new ways to prevent or slow down the progression of posterior capsule opacification, including exploring new IOL designs and pharmacological interventions. As technology advances, the management of this condition is likely to become even more refined.